when I found out that Digital Health and Dr. Cook created a new company, ZYTO. Then I literally, the day I found out about it, or maybe the next day, I bought a ZYTO, and we've been using the ZYTO ever since.
I used to do kinesiology testing for my patients because obviously one vitamin is not going to work for everyone. And in fact, a patient might need a B vitamin, but they might not test well for this particular B or that. So I did a lot of kinesiology testing. We don't use the ZYTO as a diagnostic tool, but what we use it as is, I call it kind of a roadmap.
So a part of my purpose, a part of my goal and plan is being Dr. Bob, the drugless doctor, is to educate people, to let them make wise choices. When somebody comes into our office, the ZYTO process is a part of the plan.
It's great for us, for me, and for the physicians that I can give them that roadmap and say, okay, this is what I have discovered.
I love it when Dr. Cook says that the ZYTO is an information technology. It puts the information in front of you and you have to intelligently digest that information and then choose if that can be used and then do the best thing that you think you can for the client in that moment.
It's an excellent tool. It gives great information.
Every patient that's in our office within the first 2 months has at least one ZYTO experience, and then we normally will reassess patients every month or every 2 months. And it's an integral part of their wellness program at our office.
For me, I love being able to see the results very quickly.
We have the greatest tools on the planet right now available to us, and the ZYTO has just made it easier for this to happen because we can scan huge volumes of information.
What I love about the ZYTO technology is it interfaces with established Western medicine assessments. And you know, I would ever want to not have ZYTO technology because it interfaces. We're in our 4th year already, changed our practice life. And it's as important to me as my toothbrush is right now. And I say that sincerely.
And what's exciting is that people start to become in tune with really what I do in relationship to my lifestyle is a reflection of how I'm going to feel. I think more clinics should use this. It's really interesting when patients come and say, why don't other clinics have this? This is the first time I've ever seen this. God, everybody should have this. And I say, yes, everybody should. Because
it's information specific to the question you asked about the individual. And then to bring all the individuality into some type of a report or some way to make a decision about an individual is unmatched by any device ever built that I've ever seen or used. And that information is what's going to help us bring people on their journey to wellness.